Welcome back. It's hard to miss just how quickly parts of the state are changing. The massive new neighborhoods, the cranes and construction happening all across the metro area and beyond.
Yeah, now at the same time, there is a health concern getting worse and worse among our construction workers. As reporter Anusha Roy joins us now, and you've had some frank conversations about mental health and substance use.
Yeah, unfortunately, construction is at the top of the list when it comes to suicide rates, according to the CDC. And experts say the overdose statistics are even more daunting. There are a couple of big factors here: working long hours and away from family, people getting hurt at work and then being prescribed opioids for pain, lifestyle, and a culture around just toughing through that emotional pain. All of that is now adding up to some statistics that have really caught the industry's attention. And here in Colorado, they're starting to change how they do things at work.
There's one specific story that we've talked about a lot where there was a gentleman who seemed kind of distracted, just real tired, and I think it was that his child had been in the hospital overnight, but he didn't want to miss work, and so that could potentially have created a dangerous situation.
Amy Munoz is with Saunders Construction and says the CDC statistics really validated what they were starting to see themselves. And they aren't the only company right now connecting with mental health experts like Dr. Sally Spencer-Thomas.
We know how dangerous construction is. We lose about 1,000 workers to falls and that kind of thing on a job site, 5,000 plus to suicide, and upwards of 14,000 die from overdose. So once the construction industry got this information, they knew they had to do something.
So Dr. Spencer-Thomas was talking about national numbers there, but she was also saying that Colorado was one of the first states to really lean into this conversation around mental health. As for changes here, some companies are spending time working around language barriers and really working to put together best practices so that people feel safe to ask for help earlier without worrying about retaliation, and then trusting the resources that are being offered as well.
Yet another industry that is so important to us that we don't often think about, what they're going through, Anusha.
No, I mean, you think about all the times we've driven by that construction site, or you're seeing that giant neighborhood go up right next to you, and then you're never really thinking about how is their health doing. They're playing such a critical role in this state, but at the same time, a lot of people have been suffering, and now the industry's trying to address that.
Yeah, well, I'm glad they are, and I'm glad you're putting a spotlight on it, Anusha, so thank you.